All
right.
We
did something pretty amazing last week here on 2 News. We oftentimes go to Intermountain Medical Center, and there at the hospital, there's a saying that the emergency trauma department saves lives, and then up on the 12th floor and the rehabilitation unit, they put those lives back together.
At age 21, most of us were worrying about school, jobs, or relationships.
I was working and going to school.
Little did Willie know his life was about to change.
I started getting this kind of twitching motions on my arms, and I, really didn't think anything of it.
But they started to get worse, and that's when Willie went to the ER at Intermountain Medical Center. After an entire day of tests, the doctors found the worst: cancer.
It turns out I had a tumor the size of a golf ball in my brain/spine.
And it got worse from there.
Then the doctor gave me some really terrible news. They said, Willie, if we take this tumor out, it's a really super dangerous surgery. They said, if we do this, you have a 10% chance of staying alive. But if we don't take it out, you only have a few months to live. So I kind of had to pick my poison there, and we chose the surgery.
After the surgery, Willie spent 3 months at the hospital's Neuro Specialty Rehabilitation Center.
I couldn't pick my head up, I couldn't stand up, I couldn't do anything.
And it's here he relearned many of his motor skills.
Like I said, it's unbelievable to look back to where they have brought me, just all the work they put in.
The rehab center helps patients with brain injuries, stroke damage, and spinal cord injuries, and they regain some control over their bodies and their lives.
Our job is to try to help people get their lives back together and find some meaning in their lives.
We get to restore them to at least most of the time functional, where they can live at home, live out in the community.
And that care extends to long after the patient leaves the center.
We have to follow people well after they leave here. This is just the start.
It's not just mobility that patients are working on. The rehab center also offers services for breathing, speech pathology, nutrition, and even therapeutic recreation.
And that means we can take people who are much more acutely ill because we have all the services and specialists right here.
And that means a better outcome for Willie.
It's easy to get discouraged. It's easy to say, man, I'm so bad that I'm giving up. But, these guys, they never, they say, no, you're doing good. Keep going, keep going.
Well, Intermountain Medical Center also encourages families to get involved with the healing of a loved one. Starting from patient admission, families are involved in developing a treatment plan for their loved one and are urged to help them with their rehab.
Coming up, we're going to hear more from Willy. He's here today, and he's going to talk with him in just a minute.
We got him in here, and when you hear more from Willy about his story, it really kind of puts things in perspective. So we wanted him to come talk to us a little bit. So we'll talk to him next on Fresh Living. Well, I couldn't be more excited and happy to have my friend Willy here today. Willy, we just shared your story with everyone that you were diagnosed with a brain tumor. Doctors said they needed to take it out. You had a 10% chance of survival, and if you didn't remove it, you had a few months to live. This was back in November, but you're here now. You're here today. How did that experience change you as a person and your outlook as you move forward?
Definitely, it helped me appreciate life a lot more. Just treasure every moment, that I'm alive. And, I just wish I could help anybody that's going through this, just because there's so many people that helped me go through this experience like at IMC. So.
And when I met you last week and we chit-chatted and I first heard about your story, I have to say it kind of pulled me down. Well, you put me into perspective because it's easy to get discouraged. I'm having a bad hair day. Oh, man, I missed this. Or the trivial things. You kind of forget about the bigger picture. Would you agree?
Absolutely. I mean, when I was, before this incident, I was going to school and working, and I just, we always think about, I want a better job, I don't want to go to school, and then something like this happens, and you're like, I'm so blessed that I could go to school, that I do have a job, and like you said, it just changed my whole view of things.
Where did you find your strength to get through each obstacle, each day?
I would have to say the hospital kind of forced the strain. When I was on rehab, I had a schedule. And if I didn't feel good or didn't want to do something, I kind of had to do it anyways. So, I mean, I have to thank them a lot, obviously, because if it wasn't for those, you know, that hard time and that suffering, I want to say suffering, yeah, that I've been through, I wouldn't have been to where I'm at now.
Yeah.
So.
What's next for you, really quickly, Willie? We knew you were going to school and you were working. What's next? What do you want to do?
I want to slowly start going back to school. Maybe go back to work. And just continue life where I was before.
And enjoy each moment, I'm sure.
Correct.
Without a doubt.
Yeah.
Willie, thanks so much.
Yeah.
Keep getting better. You look fabulous.
Thank
you really
you.
do. I'm so happy. We'll keep in touch, okay?
Okay.